Okay, I definitely want to appreciate all you keen participants and not make you wait any longer. So, to those of you who've been able to join right at the beginning of our session, good morning, happy Saturday, and welcome to our Sickle Cell Disease and Pregnancy, a Patient's Perspective Learning for Life session. My name is Delaney Hines, and my preferred pronouns are he, him. And I currently serve, as you can see on the title screen, as a member of the Board of Directors of the Sickle Cell Awareness Group of Ontario, SAGO, and I'm also the chair for the Education Committee. If you or members of your network would like to refer to the information in this session, a recording of today's session will be posted on our website following the session, of course, for viewing at your convenience. Just for those who may or may not know, I'll insert the website in the chat for you all to access at your leisure thereafter. Just going to continue on. So here's a quick synopsis of today's agenda. As you already can see, I'm delivering the welcoming remarks. We'll then go through a land acknowledgement, few housekeeping rules just to maintain a level of decorum throughout the session, SCOGO's role, an overview of the webinar, introduce both of our speakers this morning. We're still waiting one, so at the moment we'll introduce one of them, and then we'll have up their presentations, the respective session of today, and then opportunities for you all to ask questions. So as you can see, we'll be hearing from both Thea Campbell and Nisha Curtis, who I will introduce shortly. But just before going there, I want to make sure you have a sense of what the logistics are. As I mentioned, this session will be recorded. So for those who are just jumping on now or joining a bit later, they'll have an opportunity to catch any pieces they may have missed. And for those of you, if you have any questions as you hear the panelists, please use the question and answer feature, which you'll see in the toolbar toward the bottom of your screen. There's also a chat function as well, where you can send your questions to us or to anybody who's actually moderating the session. We'll all be able to see them and be able to respond to them accordingly at the appropriate time. And then we'll go through as many as we can. As you know, we're here from 11 till 1. So please do feel free to submit your questions at any point in time, but we'll try and prescribe a portion of the session to make sure we get to those. At the same time, we do ask if maybe you could, cordon them off to one point in time during the session so we don't get too distracted. Also, we kindly ask that you respect the learning that's being done this morning in this space by abiding by the following housekeeping rules. So please ensure your microphones are disabled, which they should be for the duration of the webinar. If you'd like to ask a question, as mentioned, use one of those two features. A closed captioning should be provided. So I believe if you look in your added features at the bottom, there should be a closed caption function. If not, let me know, we can make that adjustment. Please use respectful language in the chat, which goes without saying, so no profanity or inappropriate language. Please do not post any other material unrelated to today's discussion topic. We want to try and keep things on task for those who've come to learn about this topic in particular. And if you can keep discussions and comments on topic as much as possible by way of the chat, that'd be greatly appreciated. SCOGO does reserve the right to pause a session or to seek removal of participants who or do not abide by these rules, but I thank you in advance for your understanding and agreement to positive participation this morning. Further disclaimer, I just want all of you to remember that the information shared today does not constitute medical advice. It's being shared with you for information purposes only. So no material shared with you today or any of the actual recounts of personal experiences are intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or care provider, a qualified care provider, with any questions you may have regarding a medical condition or treatment before undertaking any new healthcare regimen that you may hear about today. So please do not disregard any professional medical advice or delay seeking it because of something that was said or posed in the chat, for example, during today's webinar. Want to jump right into our land acknowledgement. So we're grateful for the opportunity to gather, though virtually, on this land, and we thank the generations of Indigenous people who have taken care of this land long before other nations or groups have arrived. In particular, we acknowledge the traditional territories of the Ojibwe, the Anishinaabe, and the Mississaugas of the New Credit, whose territory is covered by the Upper Canada Treaties. We also recognize the contributions the Métis, Inuit, First Nations, and other Indigenous peoples have made in shaping and strengthening this province and this country as a whole. We also need to continuously educate ourselves about the colonial history of this country and understand how the wrongdoing of the past still impacts the present and the future. I encourage everyone at this session to actively seek information and take action. I can post a link in the chat later on that also helps you understand what territories you're currently occupying and which trees fall underneath. So I wanted to also, without further ado, say good morning to everyone, but I wanted to introduce our one speaker who's currently online at the moment, Nisha Curtis. So Nisha Curtis is not only a woman, a wife, and a proud mother of three. She has sickle cell and was diagnosed at 6 months. She's used every experience, very frequent and lengthy hospital admissions, and she's faced a threat of death numerous times. In 2016, she endured a pulmonary embolism that nearly took her life, prompting her hematologist to make significant changes to her medical treatment. At present, Nisha receives monthly exchange transfusions, which have proven to be life-saving for her. So she's joined us this morning. Shortly, we'll also be joined by Thea Campbell. Thea is a Canadian-born individual with roots from Jamaica. She was diagnosed with sickle cell at the age of 2. So despite facing the challenges of living with sickle cell, she built positive relationships and successfully overcame painful episodes and hospitalizations. She defied predictions and became a mother in 2014, which is a fantastic blessing. With a diploma in social service work, a bachelor's in criminal justice, and just over 7 years of social work experience, Thea is dedicated to advocating for those affected by sickle cell disease. She strongly believes in the well-being of families and children and aims to maximize their health and wellness outcomes. Beautiful. So as I mentioned, we're currently joined by Thea at the moment. So I'm going to stop sharing my slides and ask Thea if she wouldn't mind coming back on camera so that we can be joined from her and also hear about some of her experiences that she's been willing to share with us this morning. Morning,
You
Nisha.
mean Nisha?
Oh, sorry, slip of the tongue. I was just talking about Thea. Sorry,
That's
Nisha.
okay. I
How are you?
figured. I'm good. Good morning, everyone.
If you could say good morning in the chat, that'd be great. We made an effort to mute folks just so we can make sure that there's no disruptions. But yes, thank you, Nisha, for saying good morning. Really appreciate you being here this morning. Just to give you a quick prompt, really hope that you could share with folks online your experiences to date, how they've shaped you, and how they've been able to inform the way you've been, traversing your life, living with sickle cell and being a mom, etc.
Yes. So I have 3 children, as stated before. My oldest is 9, so that would be 2014. My sickle cell at the time wasn't the greatest. Like at that point, actually, it was probably the worst that it was. But I wanted to be a mom. That was always something that I wanted to do. So my partner at the time, it was now my husband, we decided. The thing about it is we met in high school. So I knew before getting pregnant that he wasn't a carrier. But I would always suggest, to get your partner tested just in case, because I've had family members that didn't. And then later on, the child turns out to have sickle cell. So that's just one of my recommendations. But I knew prior to that my husband was not a trait carrier, didn't have sickle cell from high school. So they still ended up testing him when we started our special pregnancy care. So because I wasn't being seen by hematologists or anything, once I got transferred over from being a teenager to adult, I kind of got lost in the system and I wasn't being treated by anyone for my sickle cell. So that's probably why it was not the greatest at the time. I wasn't really seeing anyone, wasn't getting my regular checkups or anything. So when I got pregnant with my firstborn, that's when I actually got connected with a team. So my advice is to always probably see an OB as well as your hematologist to kind of have a pregnancy plan prior to getting pregnant, so they can give you the pros, the cons, the risks, any knowledge that you need moving forward in your pregnancy. So my husband and I, we got pregnant. To be honest, that was not a successful pregnancy. I did have my share of miscarriages. I'm going to be very transparent about that, but it didn't hold me back from trying. The first loss was hard, like all, but we still, wanted to try. So we're back again. And this time we got to the 3-month mark. And when you get to the 3-month mark, that's when your hematologist will place you with the special pregnancy clinic, at least here in Canada or in Ontario. So I got placed with the special pregnancy clinic at my 12-week mark. And that's when I got to see baby. But the thing that I liked about the special pregnancy clinic is they screened me consistently through the pregnancy. I got to have extra ultrasounds. I saw the baby every 2 weeks. They did all the tests that were designated for my sickle cell. So with the special pregnancy clinic, you have a hematology that focuses directly on sickle cell, and you have the OB that focuses directly on baby, but they work hand in hand to focus on mommy and baby together versus you seeing a doctor somewhere else, they making a prescription or a diagnosis for you, and then you go to the OB and then that's not good for you. So when you go to the special pregnancy clinic, they kind of go hand in hand. The only thing is you have to wait until you're 12 weeks before you get placed with them. So we're at our 12-week mark now. Baby's doing well, growing. I'm seeing baby every 2 weeks. And with my hematologist, they placed me with, she did a lot of testing that were important in pregnancy. So for pregnant women with sickle cell, eyes is very important to be checked. Your heart, they had to make sure my heart was strong enough in order to give birth, to push. So I had like MRIs, and I know that people are like scared to have MRIs in pregnancy, but in certain cases, it's very important because if my heart wasn't strong enough to deliver, then C-section would have had to be an option. So we had that put in place. She also did tests for like my iron. And at that point in my life, particularly, I'm not speaking for anybody else, but in that point of my life, because I had received so many transfusions, my iron levels were very high. So I'm going to go back to that. Because my iron levels were very high, they took me off the regular Materna, Paterna, what regular pregnant women would take, because, you know, you're trying to make sure baby's okay. So for me, particularly, I was only given folic acid. And then with my first, I had a vitamin, I think it was called Pregvit. They removed the iron one from my care plan because I had too much iron in my system, which becomes dangerous with people with sickle cell or in general. So for me, those were the medications. And because I also had so many transfusions, they also placed me on a blood thinner, which was called Lovenox. And unfortunately, that meant that I had to inject myself every day throughout my pregnancy to make sure that my blood didn't clot or anything of that nature. So I was on Lovenox through the whole pregnancy, through actually all 3 pregnancies. And once I had the baby, they kept me on the Lovenox for 6 weeks post-pregnancy to avoid any clotting or anything of that nature. What else did I want to tell you guys? So let me check my notes. So my first crisis, which is a lot of questions that a lot of sickle cell patients ask me, did I get crises in pregnancy? How did I handle that? Did I continue to take my pain meds? Was it harmful to the baby? So my answer to that would be yes. I tried so hard in my first pregnancy to not take any pain meds. And that actually backfired because I was trying so hard to get through crises without pain meds that I actually made myself worse. So I had my first crisis at about 11 weeks. I went to the emergency, and unfortunately at that point, they could only take care of me. They didn't really do anything in regards to baby. They would just focus on me in the crisis, and that's it. But again, moving forward, now when I was 16 weeks and I had my first crisis at that point, and now that I was part of the special pregnancy clinic, they now had a system set up where I didn't go to the regular ER with everyone coughing and sneezing and all their germs. They had a special pregnancy ER designated to mothers like myself. So I would go in anytime at night. Sometimes I could even call them and let them know I'm on my way. And that was at Mount Sinai Hospital, which was also where my care plan was taken care of for baby. And I would go to the pregnancy ER, and they would either admit me right away based on my symptoms or treat me. But at that point, they would treat me and baby. It wasn't just, oh, we're just taking care of the sickle cell. We're not going to take care of baby. They focused on both me and baby because that's what they were designated for. And I'm grateful for that one because it avoided me sitting in ERs and, being exposed to people with all sorts of other things. I was able to go there and either directly get admitted. They knew that I had sickle cell. They knew, who my OB was.
Yeah.
And there was like certain care plans put in place. If Nisha comes in, you're allowed to give her this amount of pain meds. You're allowed to give her, start IV, start oxygen, whatever it may be. So I'm going to go back to when I was talking about the pain meds. My hematologist at the time, he told me, do not stop taking your pain meds. You're actually putting your body in stress, which is putting baby in stress. So for myself, I was on hydromorphone through all my pregnancies. And they just let me know that it was fine to take the pain meds throughout my pregnancy, but to take care of myself, because if I'm not good, then baby's not good. So I had to make sure that I'm taking care of the sickle cell part of it. And then they would worry about baby. But a lot of times you just think, oh my gosh, I feel this way, baby's not feeling well. But it doesn't work like that. The placenta does a lot to filter out a lot of things that you don't think about. And for myself, that was my worry. I'm thinking, oh my gosh, I've taken this amount of, hydromorphone. My baby's probably like high as a kite in there, or, unwell, because there could be no way that this baby's taking that. But the placenta would filter out. Baby was fine. I want to also touch base on that again, because as much as I'm saying that baby was fine with my son, which was my second child, I had a lot of narcotics in my system. And I'm not trying to scare anyone. Again, this is my story. My son particularly, he was born with something called NAS, which basically meant that he was somewhat addicted to the pain meds. So because he was so used to having it throughout the pregnancy, now when he came out, there was no, meds in his system. He kind of had withdrawals from the medication. So again, the first night that he was born, I knew something was off. Like he had a high-pitched scream, he had jitters. He was very sensitive to light. He wasn't latching my breast. He wasn't drinking his milk. So I knew from like the first 2-3 hours, like this is not normal. And they tried to reassure me, he's fine, he's fine. But because I had my daughter prior to, and I was like, she didn't do any of that stuff, which all babies are different, but I knew right away something was off. So they did this screening, and they did tell my husband and I that he did have NAS, and not to worry, like it wasn't going to cause any long-term effects. But I'm being transparent in this, and it did scare us, because we're thinking, you guys told us the pain meds ain't going to do anything, and now my son's here, addicted to the medications. So they ended up putting him in the NICU. He was there for 10 days, which was very hard, because in your mind, you're like, you guys told me he was going to be fine, and now he's hooked up to all these things. But he was fine. Like this kid is jumping off of, doing Spider-Man tricks and backflips. So I'm like, this is the kid that we were worried about 6 years ago. And now this is the one that's giving me a heart attack. But what they did was they put him in a dark room because he was sensitive to light. And then I can't remember the amount of hours, but every so often they would give him a little bit of morphine. And that was to taper him down, because he needed the drug. They had to still give him the drug, and that was to taper him down. But in the bigger scheme of things, he was fine. Like it wasn't like, he had brain damage or any of the things that we would have been concerned about. He's reading, he's doing everything that he's supposed to do right on schedule. When we did take him home, they did tell us that, he needs extra cuddles and he needs to be in the dark. This kid still needs the extra cuddles. Like last night, like, can I get some cuddles? Like, so my point is he's fine.
He's fine.
And it was my only, if I was going to say, out of all the pregnancies or all my concerns, that was the most of it. Again, everybody's journey is different, but out of my three, that was the only thing. I did notice with the last child, I did notice she had a bit of the NAS. They told me she was fine, but I knew because I had gone through it with my son. And all they did was, I had a couple more extra follow-ups to check on her and make sure that she was fine. She didn't have to do the NICU. She didn't have to do the taper down. She did need the dark room and the extra cuddles and stuff of that nature. But for the most part, they were fine. Also, something that I had to do in my pregnancies was exchange transfusions. So like I had said previously, my sickle cell was horrible with my first child. My sickle cell levels were probably in the 70s or 80s at the time. I was crisising probably every other week, every other month. And they decided, I think around 8 months, that it was best to try and filter out some of the sickle cell. So basically, they're going to take out the sickle cell and replace it with fresh donor blood. So because I didn't have a port and my veins were horrible, like most of us sickle cell patients, our veins are horrible, they ended up putting a line in my neck, and that was to get a vein big enough that they could do the procedure of taking out and putting in blood at the same time. So I had to do that for 8 months, 9 months, and then she was there. And I said to myself, never again. But by the time I had my son, I started exchange transfusions because of my pulmonary embolism. Because my sickle cell was really bad at the time, which was actually worse than with my daughter. I, stopped having my menstrual cycle for 2 years. I was in the hospital literally every 30 days. Like my husband would be counting it, and it was like on the 30-day mark, I guess that's when my cycle would end of my blood, back in the hospital, screaming at the top of my lungs. My husband's dropping the baby to my mother or my mother-in-law. He's staying in ER, going straight to work. Like everyone, I always tell people, my husband, when I'm saying sickness and in health, this man has been through sickness and in health. So we were at that point when I had my son. And so my hematologist at the time suggested we just stay with the exchange transfusions. And that was, again, to filter out the blood, make sure that, I'm limiting the amount of crises that I would have during pregnancy. And short after my son, I think I had maybe 2 or 3 more miscarriages, but we still wanted another. And I decided March of the pandemic that the manual exchanges weren't working for me. And my SS levels, even though I was having these exchanges, my SS levels were still pretty high, like maybe 50, 60. And my goal for my personal self was to get my SS levels down to at least 20%. And I had this talk with my husband. A lot of people say that my third child appeared out of nowhere. No, she was planned. We had we spoke to our hematologist. I told him, listen, I know I might sound crazy, but we want to go for a third. And just the fact that I had suffered the losses, I had to have a plan in place. This is something that I'm going to suggest to everyone, have a plan in place, see what your sickle cell levels are at, see what, they can do for you. So with my last one, I switched from having manual exchanges to automated exchanges, which filtered out my sickle cell down to 20%. When I got pregnant with my last one, my sickle cell was probably at its best. And I'm not saying that I don't have crises. I'm not saying that I don't feel pain. I'm not saying any of that. But out of all 3 pregnancies, I was probably my best with her because my SS levels were down. I still do the exchanges every 4 weeks. But in regards to pregnancy, that I would say was what helped. My blood, was obviously at better. I didn't have as many crises throughout the pregnancy. And she's here, she's healthy. Actually, all 3 kids are healthy. But for myself, I personally feel that the exchange transfusions are what, for me, helped to get me through the pregnancies or keep me healthy through the pregnancies. And then as I go back to the special pregnancy clinic, I'm going to suggest that was a huge factor in getting me through, because my OB would take care of baby and make sure baby was okay. They ran tests. There's certain things that, flagged, like with my son, he had a little spot on his brain, I think. And with my third, she had a little spot on her heart. And they were concerned, but I guess I had too much, I want to say, I think it's calcium. I'm not sure, but I had a little bit of too much of something and it flagged. But again, because I was at the special pregnancy clinic and I was seeing them every 2 weeks, they were able to catch these things sooner. They were able to check my placenta. Again, with my son, with my placenta, I think during the last trimester, my placenta stopped doing what it was supposed to do for him. And that was resulting from the sickle cell. So if you have too much, too much sickle cells acting up in your placenta, the placenta is not doing what it needs for baby. So with my son I think he was born at 37 weeks, which was exactly full term on that exact day. But they had to do a lot of ultrasounds because he stopped growing. And he stopped growing because my placenta wasn't doing what it was supposed to do for him. And that is something that's very key in pregnancy. But again, with sickle cell, if your placenta is affected by, you having crisis or things of that nature, if your umbilical cord doesn't have enough oxygen, baby suffering. So seeing the special pregnancy clinic, they were able to monitor me, my placenta, baby, and they knew right away when something was wrong. And they ended up taking him out at 37 weeks. I never went full term with any of my children. So I would suggest, again, if you are pregnant or going to get pregnant with sickle cell, just have that in mind. You probably won't go full term because, and I'm not saying not to the end, you still will go 3 trimesters, but you might not go the full 40 weeks because there's a lot of things put in place. So for example, with myself, all 3 pregnancies, as I said before, I was on blood thinners. So I needed to have a care plan put in place, because with the blood thinners, you have to stop them 24 hours prior to delivery. So they would give me a date, which was usually 2 weeks prior to my due date, to say we're going to have an induction, so that they have a date where they can stop the blood thinners and then you deliver baby. Now, unfortunately, with my last, they gave me a induction date, which was 2 weeks prior to my due date. But my whole family, this is right in the pandemic, my whole family my husband came home with COVID. And I called my OB because I always go every Friday. I called my OB, let them know that my husband came home. We put him in the basement, but he has COVID. And they said, you need to get out of the house like yesterday, like right now. And I'm like, okay, but I'm coming tomorrow. They're like, no, because you're already high risk. You're pregnant. We don't want you on a ventilator, And then, I don't know, I guess it hit me like, wow, I'm really having a baby without my husband. My mom was taking care of us. She came to when baby comes, my mom's there to take care of us. My mother-in-law's household was sick. My mother's household was sick. And now our household is sick. So now I'm thinking, where am I going if I can't come home? All my core people are, infected with this damn COVID. So when I called my OB to tell her that my husband had COVID, she's like, we have to take the baby out right now. And I'm like, okay, but I have 2 weeks, I'm not ready for this. She goes, no, Nisha, you need to come. The only thing of why they didn't take my child out that day is that I took the blood thinner that morning. So they needed to do the 24-hour wait in case I had to have a C-section, in case I needed the epidural. The reason for that is you can bleed out into your spinal cord. You can bleed out. So they need to stop the blood thinners. So that morning, I think they had switched me. I used to take them at night, but 3 weeks prior to that date, they switched me to the morning. So I took it at 9 in the morning. My husband test came back at 10, and they said, you have to leave the house. So they put me in a room. told the hospital that, you know, Nisha Curtis is coming. They had a room ready for me, and pretty much I had to say bye to my whole family, my kids, my husband, my mom, my support, and go. And I'm literally there by myself thinking, how am I doing this? How did life turn like this? And very difficult time for us, because even after that, we weren't able to come home. So my husband missed the birth of the last child. My mom wasn't there. But I want to say my best friend was by my side. And when we were discharged from the hospital, we stayed with my best friend. They took care of us there. But I'm going to admit it was very challenging, because you don't think, you know, you have this plan in your mind. And then now sickle cell is one thing, but then COVID was another. They put me on postpartum watch as well as COVID watch and sickle cell watch. So I had people calling every day after I had the baby, because how's your sickle cell? You know, and then it was postpartum. How are you feeling? No, I'm not going crazy. Yes, it's a depressing time, but I'm okay. But they had all these things put in place, which you wouldn't have had if you didn't have the special pregnancy or a care plan and all of that. So the blood thinners are a big thing, but you have to also have a plan in place in regards to giving birth. Just know that you're not going to the end, because it's important for you to it's important for you to have a date scheduled if you're on medication. What's up? And a few other things I was just going to touch on. So yeah, just to make sure that you have a scheduled date for your delivery. Make sure that you are on your proper medications. They also put me on baby aspirin partway through the pregnancy. That's another important thing to avoid preeclampsia, which is high blood pressure. Very risky. And that's not just with sickle cell, that's with pregnancies in general, but it was important for us to be on that. But yeah, here I am, 3 crazy kids.
Nisha, wow. I mean, I know we have another speaker lined up. I have so many questions for you. I'm sure our audience members do. But first and foremost, thank you for walking us through each of those journeys. Like you mentioned, they all
You're
seem
welcome.
unique and they had their own challenges. But I'm so happy to hear you came out the other side with 3 beautiful young ones. Okay. So that's fantastic, folks. Remember to save your questions as we have our second speaker joining us, Miss Thea Campbell. If you wouldn't mind coming on camera and turning on your audio. As you can see, her little one is currently on her arm at the moment. Thea, I provided folks with a brief intro to you a bit earlier. So maybe without further ado, you could, much like Nisha, walk us through your journey with pregnancy while living with sickle cell.
Hi, everyone. Happy Saturday to you all.
Happy Saturday.
Naisha, thank you for sharing your story as well. I, too, am a carrier of sickle cell. I have SC. And I have a lot of similar experiences that Naisha has. So both my pregnancies, so this is my second one here. I had to go grab him because my family traveled today, so I'm kind of stuck with him by myself today. So he's my most recent. Today, he's actually 4 months old. I have an 8-year-old who's turning 9 this year. Now, both my pregnancies were not planned. And so when we found out that we were expecting my daughter, it was a shock. The reason why I say it was a shock is because prior to her, I had literally 7 miscarriages. After some time, I actually had a fertility doctor or a doctor who was experienced with pregnancy at the time tell me that because of my sickle cell, my eggs are too old. I might not be able to have any children. You know, all of the stereotypes and all that good stuff. I call it the good stuff because I feel like what they're telling you with as a person living with sickle cell, that it's good news for you to hear stuff like that. So eventually I started to believe it. I didn't think I could ever have a child. So when I found out I was pregnant with my daughter, it was actually quite shocking because I remember literally passing something really bad out of me. And I thought, okay, let me go to emergency, probably another miscarriage. When I went there, I was actually stopped. I was stopped midway leaving the emergency department because I said, hey, we've gone through miscarriages before. I just need my Tylenol. Let me go home. And a doctor stopped me and said, I need to talk to you. So when I went back, he said, you're actually pregnant. I said, no, I'm not. He says, yes, you are. I said, no, I'm not. I've gone through quite a few miscarriages. I know how this is. I'm not able to have a child. He actually turned the screen to me and said, you see this? And he pointed out to the fetus and said, this is a fetus. I literally left and I was speechless. I had nothing to say to my partner. I was just totally shocked. I wanted it to be a secret because, you know, eventually some family members started to believe too, like, okay, Tia's not going to have any kids, you know? So I said, I don't even want to share this because I don't think this baby's going to last. My partner looked at me and said, nope, this baby's coming. I said, okay, we'll see. Sure enough, she came. Now, at my time, I had no knowledge of hydroxyurea, no knowledge of baby aspirin, no knowledge of none of the stuff that we have today and that I took recently with my son. So when I hit 5 months, I was experiencing quite a frequent amount of sickle cell crises. I was constantly in and out of the hospital myself. To my knowledge and what I remember is taking lots of codeine. I was actually told to take codeine and I refused to take codeine when I was home. Same thing what Naisha was saying, like I didn't want to harm her. I didn't want her to get addicted. I was actually putting myself through severe pain and just trying to deal with it myself mentally, which I paid for later on because I refused to take anything, not even Tylenol when I was having a crisis. I was literally relying on heating pads and hot water. And it took my hematology doctor at the special pregnancy clinic to like practically almost yell at me like, you need to stop and take your pills because you're actually harming the baby, exactly what Naisha was saying, right? And as a first-time mom, you want to make sure, especially when you're coming from a place of miscarriages too, that you actually deliver a healthy child. Because me even reaching to 6-month mark, I was like, oh my gosh, excited. You know, like I passed that stage where if the baby is to be born premature, the baby has X amount of percentage to live, right? So I didn't want to interfere with any of that whatsoever. But my body couldn't handle the crisis anymore. And my daughter was born early. She was due in December. She came in November. And I walked into one of my appointments, and I'll never forget because my mom was with me that day. And they said to me, well, my hematology looked at me and she said, you actually are experiencing placenta insufficiency right now. And your daughter's not gaining the new nutrients in your stomach right now. I said, what does that mean? She said, well, we're going to watch you, but if you have a single crisis one more time, we got to take her out. I said, nope, she's not ready to come out. I need to go 40 weeks. This is not fair. You know, my mind's racing. You know, my mom at the time, well, you know, she was like, you need to stop. She's also an RN herself, and she said, you need to stop. Delivering this baby will be the better option for you right now. Everyone said she needs to come out, you know, but I'm standing tall and strong by myself. I said, no, she's fine. She's going to make it to 40 weeks. We made it this far. God's not going to do this to me, X, Y, X, Y. Sure enough, I went home, fell right into a crisis. I literally broke down. I was crying. Meanwhile, I'm crying. Everyone's packing my bag. You know, everyone's like, you're coming in this car. We're dropping you off, like she said. You know, I had no choice, but honestly, looking back, I'm so grateful of my support system because I was really being stubborn that day. But again, coming from that perspective of just wanting to have a healthy baby was just all I was thinking about. She did end up in the NICU. She had low sugar levels. So she was there for about 4 days. She was also born with the umbilical cord wrapped around her neck. So they had to work on her just to kind of build back up her breathing, X, Y, Z, et cetera, et cetera. I was happy with my one daughter. I said, you know what? I can't do this again. I'm not going to go back. I was really scared. I was just really scared. And I just said, forget it. Like, maybe this is just what I'm supposed to have. I'll take it. I'm going to leave it. That's it. Last year, we find out that we're having another one. So this time around, I wasn't so nervous. Mostly shocked because I really thought again that my daughter was going to be the only one. But the joy that brought us was that it's our first boy, so that was really helpful. And because I figured I'm on the hydroxyurea now, that my sickle cell levels are maintained, I should be okay. Now, I took the COVID vaccine, and I'm very happy that I did, because when I was 3 months pregnant, I had a severe cold. When I went to emerge, because that's how bad my cold was, I was told that I had the influenza A. I was isolated. I was placed in isolation. That was really scary at 3 months pregnant. So I didn't have any crisis. I'm okay up until then. Come February, my life went for the horrific turn. As of February 11th, I'll never forget this day. I never stopped having a crisis. My son was due in April, and he came in March. Literally since February 11th, I was in emerge every single week. My sickle cell was the most painful experience ever with him. Usually, if I have a crisis, I end up in emerge. I don't pass 5 milligrams of morphine. My crisis was so bad that they actually gave me 10. They doubled the amount of morphine while being pregnant. I cried. Every day I cried. They actually even had this machine of a warm blanket that they brought into the room. Mm-hmm. And I've never even experienced this before, just being by myself with the crisis pain. But my legs were so swollen that I actually was placed on blood pressure medication too. Because I'm always researching, I had a feeling and I suspected that I had preeclampsia. When I mentioned it to them, they said that's what we're testing you for. Sure enough, I ended up having it. So now I'm placed on blood pressure medication. They now have me at 10 milligrams of morphine. My swelling will not go down. It was so bad that I couldn't even walk anymore. And at some point, I stopped feeling the baby's movement. Now, this was me actually going to my doctor and begging her, can you please just take him out? I cannot even handle this anymore. I actually had an appointment one day at the special pregnancy clinic, and I left there with a crisis. And I had to go right over to Mount Sinai into emerge. It was rough. It was really, really, really rough. And I don't know what I would have done without their dad, without my mom, my dad, his parents are back home. So these 3 main people, plus my close friends and my cousins, were there. As soon as I was released from the hospital, I would come home. Here comes the ambulance picking me up, because I would walk to the bathroom and just literally collapse. And so when I got the call from the doctor, she said, we're taking him out tomorrow. It was like the biggest relief. It was the biggest relief because now they're giving me blood thinners. I'm on every medication you can think of. The only thing left for them to give me now was the hydroxyurea. But she said, you know what? He's now 37. Let's take him out. My daughter only had the low sugar levels. My son now, he had a slight level of low sugar, but he was looking for food everywhere. He's a big boy. He was born pretty big and healthy, which we're really thankful for because we didn't have that with my daughter. Had he stayed any longer, he probably would have been bigger. He's a pretty big chap over here, but he has a condition called laryngomalacia, so he breathes pretty heavy. I'm not sure if you guys can hear him now, but he has frequent visits with sick kids right now. just to monitor his breathing. My first concern was that it was the morphine that caused it, right? They said it's not. They said it's a condition that happens to all other kids, which is a relief. But your mind will go right back to where you were before, right? Because you know that you're inputting all these narcotics in your system while being pregnant. You're wondering, is something going to be wrong with my child? There's nothing wrong with how you feel. And also, when I was pregnant with my daughter, we had no knowledge that we had to even get ourselves tested, right? This was actually the first time my partner was finding out what his blood type is. So having that knowledge today to know if you want to have kids and what kind of blood type you have, it's the most incredible thing to have, because being placed with a shock like, hey, we did newborn screening and your child has sickle cell, and not having no knowledge whatsoever, it's not the best news, because as we all know, sickle cell is really painful, and it's something that you wouldn't even want to wish on your worst enemy, never mind a newborn baby, right? So knowing that he has that condition, right away we went off to thinking it was the medication that probably caused it. And so what did I do? I stopped taking everything. I said, nope, not taking anything else, because this is probably why my son's like this. And they said no. They actually gave me a whole breakdown as to what it is, that I did my own research, and it does not have anything to do with sickle cell. So it goes back to what I'm about to say, is make sure you research anything that is happening to yourself and anything that happens to your child during pregnancy and post-pregnancy. It's important to have your own knowledge so that when the doctors present to you certain medications, you'll know why you're taking the medications, and you'll know what the reason is, right? The why, the how, the where it came from, the conditions that you or your child may have. Now, like Naisha too, I'm also being followed up with postpartum. And that's really important. Do not avoid those appointments, because being pregnant with sickle cell is like a really serious challenge to face. I say serious because you don't know how much crisis you're going to fall into. You don't know what you may end up taking while being in the crises. You don't know what's going to harm the baby from what's not going to harm the baby, right? And so that guilt can sometimes, and I say that guilt because sometimes you might feel guilty. You might feel guilty, like, can't believe I'm doing this to my child. And even if you don't have sickle cell, you might feel that way. If you have another condition, being pregnant, you just want to have the perfect pregnancy, a perfectly healthy born child. So when you hear anything that's wrong, it's going to bother you. Anything can happen while you're pregnant. And so having these follow-ups, I rely on them. I have no problems throwing this kid in the stroller and heading downtown and just talking to someone, right? Because they're professionals and they can help you. It's always good to just have a reflection as to where you're coming from and how well you're doing today as opposed to yesterday, right? Because it actually helps you mentally too, to know that, what, I'm not the only one that's facing this. And listening to Naisha, that actually made me feel better right now, because I'm like, oh my gosh, I went through the same thing and I felt the same way that she felt, right? And when you look at where you're coming from, then you look at your bundle of joy, you're like, wow, we actually made it this far. And it makes you want to help others and educate them too, to let them know that this experience is something that you're not going to go through by yourself, because bringing life is never easy anyway. It's just not an easy task. And having a strong support system is so important. And it doesn't just rely on your internal support system. It's also external, meaning the professionals, having your doctor, whether it's a hematologist, whether it's your gyno, or just a social worker on site, talking to them is so helpful, right? And they offer you little like webinar classes online that you could actually join to talk to other people. And then they have the breastfeeding program. Now, speaking of breastfeeding, I wasn't able to breastfeed my daughter, but I'm able to breastfeed my son, which is also amazing. Now, what I did find out the other day with regards to breastfeeding, I was told I can take my hydroxyurea again, but when I was researching my own self, which is something that I'm going to talk to our doctors about, you have to kind of give it a space. if you're taking your hydroxyurea, you got to give it a couple of hours first before you kind of breastfeed, I believe. I could be wrong, but it's because okay, I'm not really sure, but if you're pregnant now, or if you gave birth now, anyone that's online and you're told to take your hydroxyurea, just ask your doctor, because I'm about to do the same thing myself, if you can breastfeed while taking the hydroxyurea. Right? That's the research I'm on myself right now, so I want to share that knowledge. So I'm spacing that out. I give it a couple of hours in between before, or I'll pump, or whatever the case may be, because you just want to make sure that, you know, everything that's going inside of you is going to the baby, right? So be mindful at that. And any other questions you have, don't hesitate to ask the doctor, because it doesn't stop after you give birth. You know what I mean? The concerns. You're growing a whole human being, so you want to make sure that this child is still healthy, even healthier, if anything, and they get all the nutrients that they get. And you want to also take care of yourself, because I remember Naisha said something: if you're not taking care of yourself, then you can't take care of the baby, right? So, I mean, it's cliche and everyone knows this, but sometimes it's hard. It's hard because one can have a lot going on, mentally, physically, emotionally, and all those three are connected to each other. So you want to make sure that you're okay, because babies feed off of your energy too. You know, so if you're not well, babies sense it. They may not be able to talk, but they sense that feeling from you, and you want to make sure that you're good. You just want to make sure you're good for you, so you can be good for others, especially the little ones.
Especially the little ones.
Yeah.
Wow. Thank you both for your invaluable contributions to today, not only to our sickle cell, to Chicago, but to our community. Like you mentioned, Thea, about doing your own research, being informed. For all of you online today, this is you taking a step in that direction to make sure you're getting the information from folks with lived experience, folks who can tell you the the emotions they felt, the thoughts that crossed their mind, and how they navigated these distinctions and these challenges the same way. You'll probably have to go through it as well. So I saw a few questions are popping into the chat as we speak. I also want to see, just in case folks haven't seen the questions in the Q&A, Nisha, I saw you answered a couple already via the chat. I'm wondering if you could also answer them, orally as well, so folks can hear the question and hear your response in real time.
I don't remember. I don't
And
know where they
then,
went. They answered? Okay.
oh, don't worry, I can pose them to you. That's no
Okay.
problem. Yeah. So there's one, for example, it says, yeah, has your body returned to normal? And I think
Yeah, but I
even the
didn't
way
know
you
I didn't
responded
know
was
what
great.
that
So
meant. Like how? What does they mean
exactly.
by that? Like normal how? Like my sickle cell is no different. I feel like in pregnancy, my last two, my sickle cell crises were actually milder than Tia's. But in my first pregnancy, as I said, my sickle cell was not great because my SS levels were way higher. So now, because I'm on the exchange transfusions, I don't have admissions at all. I really only had admissions in pregnancy. And to be fair, I could handle my crises at home, but because I was pregnant, I went in because I don't know, even if I'm feeling I can manage it. Again, I don't know if baby's, not doing well. So I don't know what you really mean in regards to back to normal. My sickle cell is pretty much the same. My body is back to normal. My body's back to normal. Like, doesn't look like I
I
have kids. But I don't, we have to be a little bit more specific on that one.
Okay. And Eunice, if you'd like, we can also give you the opportunity to chat. So I'm realizing, folks, as well, if you raise your hand and you want to pose your question, orally or online as well, just raise your hand and I can let you speak directly with our panelists. Otherwise, oh, perfect. Give me 1 second. Eunice is asking me if she can maybe clarify for you, Nisha. Go ahead, Eunice.
Hi, yeah, I wanted to find out because I have a friend who also has three children with sickle cell, but her second pregnancy was a twin pregnancy, and her body has never come back to normalcy. Actually, right now she goes into more crisis than she was before she was pregnant. So I just wanted to find out, is it because you're doing a red blood exchange, or is it because there's something else you're doing?
For me personally, I feel it's the exchange transfusions that changed. Like I was saying, with my first pregnancy, my SS levels were really high. And after I had my first, my sickle cell was like your friend, where I was in the hospital every 30 days. My sickle cell was worse. So maybe she needs to change her care plan. Um, because you have to understand when you have a baby, your body's gone through a lot. So that could have wore her body down, giving birth, carrying, we said twins. Um, but now after she's had the baby, her sickle cell could be at a high. So she would have to have something change in her care plan to get her sickle cell to be more under control.
Awesome. I'm seeing Sickle Cell News. You have a question. Gonna give you the opportunity to pose it directly.
Yes, thank you. Am I being heard?
Yes, yes, you are.
Okay. Yeah. The question is, do babies born to women who have sickle cell suffer, suffer in quotes, as a result of the many different complications of sickle, regular complications or complications directly related to pregnancy while they're having SCD? I mean, you have crisis, you are in pain, you have placental insufficiency. Does the baby suffer while pregnancy is still viable? Thank you.
Thank you.
Do you want to take that, Tia, or do you want me to answer?
Which question is this one?
More or
He
less
just
asking.
asked if
I
the
was
baby
typing in
suffered.
the answer, sorry.
No
Okay,
worries.
I'll answer for myself. Personally, my babies didn't suffer. Only my son when my placenta stopped working. But overall, all of my kids are healthy. They're actually stronger than me. But they don't have any health conditions. They didn't suffer in pregnancy. I went full term with all three. But as I said, my son, he had the slight withdrawals from my pain meds, and my placenta stopped working like Tia's in the pregnancy. But outside of that, overall, my kids don't have any health defects or any complications during pregnancy or after birth. My kids are all really healthy kids. I mean, they all will all have the sickle cell trait, but outside of that, I didn't have any complications with them. Tia?
Go ahead, Tia.
Yeah, so I didn't have much complications either, besides my daughter just being in ICU for 4 days. She was right back to normalcy. And my son, again, he only has the laryngomalacia, but that has nothing to do with sickle cell. He's definitely a strong eater, so he's healthy because of that. He's achieving all his milestones right now. And like Naisha said, like the both of them are stronger than me, so they're doing quite fine. It was just the pain that I experienced when I was pregnant with both of them.
I'm seeing. Thank you for that response, Nisha. There's a question back into the chat. Just want to make sure I follow the order of questions. This person says, thanks for sharing your stories. Did you find that doctors were knowledgeable on different types of sickle cell and specific pregnancy outcomes?
For myself?
Yeah.
Oh, sorry. Maybe
Oh,
go ahead,
okay.
Nisha, then Thea.
For myself, yes. I was already seeing my hematology team from before, and then I just saw the same team during pregnancy. I do feel like when different doctors came in, they were a little judgmental or not as understanding. Like if my pain meds were a little bit higher than the normal, and it's like, you're 95 pounds, how are you taking this amount of pain meds? But outside of that, the ones that dealt with my care plan specifically were very knowledgeable. They were part of the special pregnancy clinic. So they were familiar with many cases of sickle cell. So I personally didn't have any issues. I felt that my doctors that were on my care plan knew. It's only when I would go into hospital, it was like, okay.
Thea, how about you?
I wouldn't say doctors, but I definitely would say other professionals such as nurses. When I would go into the hospital with my daughter, I would get different reactions. So I had nurses that were very attentive, and then I had nurses that were sarcastic. They would say, "Oh, you have sickle cell, yeah, and you're pregnant? Wow." Literally, you know, and I was
What
like, "Okay."
hospital? What hospital did you go to, Thea?
For both,
Mount Sinai.
it was Mount Sinai,
Oh,
but
okay.
when I was living in Peel, I would end up at Trillium off of Queensway.
Yeah.
And so at one point when I went to Trillium, I guess there was a note, I guess under my name. I don't know where exactly, but it was actually stated, do not help this patient, send her to Mount Sinai. Like my
Wow.
team stepped in and said, don't even touch her, bring her to us.
Yeah.
Right.
Okay.
And
And you said,
that's when I knew that advocacy was really, really, really important.
yeah.
So I've been with Mount Sinai, but with my second, my most recent, I can honestly say I had a whole team. Front, back, side. They were helping me big time. That's when I learned about the baby aspirin, that after a certain couple of months, you can actually take hydroxyurea while being pregnant. You just have to wait a few months first before you take it. I don't remember the name of the pill for the blood pressure, but when I tell you I had a team with this boy, I had a team with this boy. It's like as soon as I would go into Emerge, they're like, oh, you're supposed to go straight up to, what floor is it again? 14, 15, or one of those floors, like bring her straight up there. It was like no nonsense, no playing around, bring her right upstairs to us.
Yeah.
Wow.
So, but it was
So,
definitely Mount Sinai. There's a special pregnancy program there.
Yeah.
okay.
Mount
So that's
Sinai is
Mount
where I went as well. And they that's where the Emerge is. And like Tia, like they don't want you going anywhere else because they're not going to care for you the way that Mount Sinai cares for you. I did, when I had my miscarriage in 2020, I did end up going to Brampton, and there was a lady there that she said, "You have a boy and a girl at home?" And I said, "Yes." And she goes, "So you're done now, right?" And then the OB that was handling me there, he was just like, why would you say that to her? If she wants to have 20 kids, she could have 20 kids, you know? So I don't think it really matters, but in regards to the special pregnancy clinic, Mount Sinai, they will advocate for you, like Tia said, and they don't want you going anywhere else. They want you to come there where they can treat you the way you need to be treated.
Great response.
There's a lot of questions.
Yeah, I'm seeing there's
Pen.
tons. I want to the one question that Thea responded to, and I wanted to make sure you had a chance to answer it, Nisha. It was up until what time did you work, or were you working while pregnant? Sorry.
Was I working?
Yeah.
No, I was not working. In 2009, I nearly died from having 2 infections in my liver, and I've been on long-term disability since 2009. And so I still work, like I'm still with my company. That's where my benefits are from. But my husband is the breadwinner. He gets the money. So we
No,
good. We good.
you're good.
But
No, dude,
I'm a stay-at-home mom.
dude sounds solid for sure.
Yes,
Kabibi,
yes.
I saw you had your hand up, and I know we've already responded to one of your questions in and around baby aspirin, but in the event you want to ask a follow-up, I wanted to make sure you had that opportunity. So you have opportunity. You can speak now if you'd like, Kabibi.
Okay, thank you so much. I would like just to know about what time, Shana, what time did you start with baby aspirin?
I think it was second to third trimester. Because usually preeclampsia comes near the end of pregnancy. It could come anytime, but it's usually in middle to near the end. So I started it in my second trimester, maybe about 6 months, 7 months.
Okay. Thank you.
You're
Thank
welcome.
you. There's lots of questions. I'm gonna try and fly through them, folks. So the next one, with several miscarriages you both experienced, how did you manage fears of recurrent pregnancy losses while you were pregnant with the children that followed? Maybe Nisha, Thea, it's perfect.
So I've kind of mentally trained myself to just block out all negativity. Because for the longest time, as I mentioned earlier, I was believing that I wasn't going to be able to have kids and I wasn't going to have my own growing family. So when I found out, I remember like I mentioned that both my kids were a surprise. I knew that, because I'm a firm believer of God, I knew it was God's plan. So I would literally tell myself, you're having this baby, especially with my second one, because the first one I was kind of skeptical, but after I passed the mark of 28 weeks when they say that the baby can be born premature and still live, I said, okay, this baby's coming. Both my kids are coming, and I'm going to do everything I need to do to protect them. So I literally mentally trained myself. It wasn't easy, but I've just learned to do this because I started doing this when I would have my own crises before being pregnant. So for me, it was just a mental training. And that's just my testimony. Like I would just really mentally train myself because it's hard. It's hard to think that this is not going to work, or you're going to have an issue, or so blocking out the negativity, it's really challenging. But whoever is negative around you, and it can start off with people too, don't entertain it and stay away from it. Because even if you don't have sickle cell, they tell you, do not stress yourself when you're pregnant. You have to stay stress-free. It's hard, but they always say, try not to stress yourself. They say, don't lift anything heavy, all that stuff, exercise. Find out what makes you feel comfortable. Like if you need to take a walk, then take a walk. If you need to just, lots of rest, taking care of your body as well physically. But it starts off with you mentally, whether you want to train yourself mentally or not. But actually, it's still kind of training yourself anyway. But you have to just tell yourself and remind yourself what you need to do to stay positive and what you need to do to help yourself and your body so that you can deliver this child. But I mean, miscarriages can happen regardless, and anything else can happen too. But you have to kind of prepare yourself for the worst, but still strongly believe that you're following all the protocols that you need to follow, and just hope for the best.
Nisha,
I'll give a
would you like to
shorter
respond?
answer than
Perfect.
Thea, but I agree. Block out all negativity. I mean, I had family members tell my husband and I, we shouldn't have kids or whatever. Cut them off. That's me. I don't care. I would always say it's you and your partner's decision, but more so yours. If you feel that you can handle this, as they say, pregnancy is risky regardless if you have sickle cell or not.
Exactly.
And if you're ready or want to embark on that journey, more power to you. Each of my kids were rainbow babies. I think my first miscarriage and my last miscarriage were the hardest. The first one, because you wonder, are you ever going to be able to do this? And the last one, it was just very traumatic. But the fact is that because, as I said, the first one's hard because you don't know, but my thing is, it's a mental thing. And for the last child, even though that miscarriage was very traumatic for me, after the experience, I don't know what it was, but I still saw this little girl. Like I could still see her. And it's the weirdest thing. I had her name and I knew she was a girl. And I believe in speaking things into existence. And maybe everybody would say I was crazy for still trying after that miscarriage because I almost lost my life. But I knew she was meant to be here. Not to terrorize me the way she does, but I knew she was meant to be here. So yeah, I agree with Tia in regards to just block out any negativity. But my only thing I would add to that is if there's anything that you can change in your care plan. So for my last one, I started the exchange transfusions. If there's medications that you can tweak or change or anything to do, in planning forward, I would suggest to do that. So as I said, with my last one, I changed from manual to automated exchanges. I made sure that my SS levels were a little lower before getting pregnant. I'm not in your shoes, but see what's different or what could be, going on. I did also see fertility, like, am I having this miscarriages? And they're like, it's just bad luck. There's nothing wrong with you. There's nothing wrong with hubby. It's just bad luck. So they do relate it to sickle cell, but just keep a positive mind and go for it.
Man,
God's plan. That's it.
God's plan. I mean, both of you are superheroes, to be honest.
I
So
was
you need
thinking
to
the same thing. God's
ye-
plan. Think of Drake.
God's plan. No, I mean, but truth be told, yeah, your little ones need to be listening to these testimonies like you mentioned, because you two have done some, I mean, imaginable feats to bring them all here. So yeah, make sure the little girl knows that she can't be terrorizing you anymore. She should be treating you like a queen. Um, so yeah, back to the questions. How did you handle, so probably back to you, Dia, how did you handle work and being pregnant with sickle cell disease? And did you need to have accommodations at work or be off for an extended period?
So I'm very transparent and honest. My first job with my daughter, that was part-time, but I did not have the best supervisor. So I went through not a good time with her. I'm not even going to sugarcoat it. When I told her I was pregnant, I presented a letter because the clinic said you need to go on, oh God, what is it called? Basically, I had to get accommodations. I did. So it was heavy lifting. That position at the time was for dietitian, dietary aid.
Mhm.
I'm not sure if anyone's familiar with that job. So it was a lot of heavy lifting. And my doctor said, absolutely not. Because I started to like have clots when I was pregnant with my daughter. So when I told my doctor, she says, nope, no heavy lifting. So when I brought it to the supervisor, she said, no, I can't give that to you. Meanwhile, there was literally 2 other employees that were not lifting anything because of a hand. And I was actually pregnant, right? So when I told that my doctor, I went back to my doctor and she said no. She said, then that's it, no more work. I said, oh, just like that? She says, yep. So I went back and I said, I'm going to ask you again if I can get accommodated and not lift anything. She says, no. I said, okay, then I have to leave. And I just went back. I decided to finish school. And so now the caseworker position, I just started working. Literally, I just started work and found out I was pregnant. And so I didn't stay long, but I worked all the way until, I found out I was pregnant around 2 months. Started working. And then I literally worked all the way till March 2nd and gave birth 20 days after that. So in between me being in a hospital, I would just jump right back into work. Mainly because I was working from home. But me sitting down and not being able to walk wasn't so helpful with the swelling as well. But because it's so weird, in between my crises, I was not feeling so bad. I was just feeling really tired, but I wasn't feeling as bad as I was feeling with my daughter. So that's why I thought that maybe I'll be okay with my son, but my crises was just another story. It was, honestly, I started to hate myself. That's how bad the pain was. So the minute the pain stopped, I felt so normal again that I would just be like, okay, I'm going to go back to work. And they said, you're not ready to stop? My doctors, they would ask, are you ready to stop? I said, no. But the last crisis I had on March 2nd, that was it. I'm like, okay, I'm done. I'm throwing in the towel. This is it for me. So that was the first time I actually got the 10 milligrams of morphine. It was such a shocker for me that I was just like, okay, maybe I need to really stop working then. That's when I started to reflect on what's causing me to have more crises. Is it stress from work? What's happening? You see what Naisha said, like find out what's not working for you in your care plan. I figured that maybe work was adding stress because I'm still trying to hold on to my position while being pregnant. And I said, okay, what's more important, work or your child? Yeah. My child's health was, my decision. So I got the letter and I just went on sick leave right away. And so do not hesitate to give that sick letter. Your employer could be the nicest person ever. Just do not hesitate to give in that letter, because I'm telling you, if there's anybody that's going to replace you, is work.
Oh yeah, yeah. Work will
Work
definitely
will
find a way.
so
Yeah, work will continue.
take care of you and take care of your babies.
Well said. Nisha, I know you answered Josephine in the Q&A, but
I don't know
Josephine,
if you want me to just answer because, or you want everyone to answer, but I feel
Mhm.
like I was trying to get rid of some of
I
their
know, I know, I
questions.
know. Certain questions, I'm thinking the same thing. Certain are pretty like easy. So if you
I
could
can
like
do quick ones.
the
Okay,
quick
let me
ones,
get the
yeah,
quick ones. So I
yeah.
didn't, I had an epidural with, I was in crisis for all 3 pregnancies. My son, they gave me an epidural because I was breathing, I couldn't breathe properly. It didn't work. I only got numb on half of my body. And someone asked if my period stopped. My periods
Yeah.
did stop after my first. Stopped for 2 years. I didn't get my period for 2 years. Don't know why. And then once I started the exchange transfusions, it came back. Okay, it's yours. I'll let you take over.
Awesome, fantastic. So maybe the same thing to you, Thea. Did you get an epidural at all during your deliveries?
I did. I did get it for both. The second one, I actually felt it. So that made me really nervous. I felt my nerve, like something happened to the nerve in my leg.
Mhm.
So I was panicking. They asked me what song I wanted to play. I chose Bob Marley, Everything's Gonna Be Okay.
Perfect.
So
Can't go wrong with
they
Bob.
offer that to you too. Mount Sinai is good like that. So they
Yeah.
played that in the entire room. But the minute I felt because they didn't let I don't know if it happened to you, Aisha, but my partner wasn't able to come in the room until they were ready. Because I did have a cesarean. I saw that question somewhere.
Yeah,
I had a
yes.
cesarean for both.
Okay.
But they don't
My,
let him in until they were ready.
mine
And
were all vaginal. I had no C-sections.
okay,
Okay.
I no, I wasn't able to do that. So the
Okay.
minute I felt his hand, I broke down.
Oh,
Um, it was very emotional. There's another question here about what was the other question again? The epidural and something
did
else.
your
Just
period stop?
My
yeah.
period. So I haven't. My period was fine with my daughter. With my son, I heard that when you're breastfeeding, it won't come, and that's what's happening with me right now.
There's another question, Thea, about did you experience any hair loss or difficulty with your vision?
So I did have a retina detachment in 2019, just before COVID. Um, but my eyes now are actually giving me a run. So I have an eye appointment coming up.
Okay.
So
So
I think, yeah, go ahead. I'll let you
when I
finish.
was pregnant a little bit, but now I feel like it's starting to be effective a little bit more. So yes, my vision definitely is on and off right now.
I think I mentioned it when I was speaking that that's one thing that they always test for, or at least with the special pregnancy clinic, they check for your eyes because your eyes do change or can get worse in pregnancy. I do find that my eyes have significantly changed since pregnancy. Um, and I mean, I wear glasses now. I don't know how badly they've changed, but in regards to hair loss, with my son, it grew. It was halfway down my back. With the
Hmm.
last one, I don't know. It like the parameter of my hair literally would come out in chunks. So my hair is way shorter now. And that could also be age, right? Like I'm 42 now, so she was my last, so that could be, based on age and or just pregnancy in general. Postpartum shedding is normal, but the first two my hair grew, and the last one it's been just coming out in chunks, and that's now it's 2 years later, and my hair still sheds really badly.
Okay.
Okay, so I forgot to answer that question too. With my daughter, my hair grew. With my son, I'm trying to save my hair with everything in me right now. So, and it's all because of those same reasons that Maisha mentioned. And I just turned 40, so my hair right now, I don't know if it's because I bleached it or what the case may be, but I don't use chemicals. I'm all natural, but my hair is just not working with me the way it used to.
And
So
yeah,
I'm
I'm all
trying to
natural.
save it with everything. Yeah, I found the castor oil, the real deal from the ground. growing like the naturalness. I'm trying to do everything right now to save my hair. But I heard
Again,
it.
that's not sickle cell. That's
Yeah,
just
well, that's
pregnancy
what
in
I was gonna
general.
Yeah,
do. It's
Yeah.
just,
yeah. Josephine, your hand's still raised. Did you want to pose a follow-up, or did they answer your question sufficiently? I gave you the opportunity to talk.
Sorry, I was just trying to I didn't realize the hand was still up, but I did want to ask again because I I'm realizing that you guys are older now. You recently had babies, and I get a lot of because of my age or the time that I'm in and everything that possible, or because of sickle cell. Find that is any underlying reason why you wouldn't be able to have kids, or have you guys gotten those reasons as to why people say like, yeah, you've been through so much because of sickle cell that you can't have kids?
I missed part of the ending. You're chipping out a bit.
Yeah, could you
What's the
repeat that,
last part of
Josephine?
the question?
Yeah, just the last part. Yeah.
Sorry. I was wondering with have you guys gotten the reasoning that sickle cell is like the reason why you can't have kids or why it hinders you from having children?
Why people say it? I don't know why people say it. I guess it's just risky, but we can have children. I got 3 brats in the next room. So it's not that we can't. It is a struggle. It is a stress on the body. But like, this is what I say. I just said I was 42. They said I wasn't going to live to see 30. They said I wasn't going to have any kids. So like Tia and I've just said, it's God's plan. Everybody's going to have their opinion, Josephine. It's what you choose to do. And like we said, it's God's will. So if you want to be a mom and you want to continue to try for a child, then yeah, I don't know what their reasons are. And I didn't really care to ask, to be honest. I just knew what I wanted to do, and I want to be a mom.
Thank you so much.
No problem.
I think it's based on people's perceptions. Because when I talk to a lot of the people, a lot of people know from the Caribbean side. They always say, "Oh, I grew up with someone with sickle cell, and he didn't live past 20, or she didn't live past 24." I didn't know you guys can have kids. I think it's just what they grew up hearing or what they seen, like their experiences with seeing other people maybe passing away early. While they said, "Oh, this person that has sickle cell, they're not going to live to this amount of years," right? But I totally agree with my shit. It's exactly what you want to do, because people could be born and then end up having cancer. A 10-year-old can get cancer. She dies. She doesn't even live to see her prom, never mind have a child, right? So it's just all a myth. It's people's perceptions. It's just their biased thinking. Um, if that's what you want to do, be a mom, go for it. Just make sure you do your research and get mentally prepared. As someone that may have sickle cell or not, and you'll be fine. You'll be fine. Just prepare yourself and you'll be fine.
Love it.
Thank you so much, Thea.
No worries.
Okay. Next I am seeing a lot of like congratulations, thanks, some comments. I wonder if we could jump to this one comment from Nicole. I'm a former Mount Sinai labor and delivery nurse, so I'm so happy to hear that you both had positive experiences there. Was there any one thing that a healthcare provider did that you would want all of us to do while caring for you during your care?
One thing.
One thing, yeah.
I can't do one. I can do two.
Oh, perfect. I mean, yeah, go for it. Go for it.
Listen and understand.
Yeah. Like no judgment.
Yeah.
Like when we say the pain is that bad, it's that bad.
Yeah. Just listen.
I'm more to tell you guys what you can't do, shouldn't do, than can. But I mean, all the nurses are pretty nice, understanding. But like, yeah, just when we say it's that bad, it's that bad. When we need our pain meds, make sure you come on time with it. And just no judgment. I can't really think of like the one thing that you can do.
Yeah. Honestly, Nicole, I'm so happy that you stepped in and asked this question, You know, just by you asking this question alone, it's really big. I'm pretty sure it's big for Naisha, it's big for everybody here today on this platform, because it lets us know that the change is going to continue, because there's a lot of changes happening and it's positive. It's moving in a positive direction, because from my when I was pregnant with my daughter till now, like they're 9 years apart, it's a lot of improvement, a lot of empathetic support. I see someone put empathy in here, but listening and understanding is part of the empathy perspective. And just exactly what Aisha said, when we say we're in pain, we are in pain. I mean, you might come across dramatic people like myself who'll say, take this child out right now. But honestly, that's just a way of saying like we are in serious pain, and it's not a joke. You know, it's not just the physical, it's what we go through. Whoever has sickle cell here on this platform, they'll know. Imagine having sickle cell pain while carrying life. You're feeling something heavy in you, a whole human being, and then not being able to walk, not being able to talk, and then you're trying to find the last strength in you just so you can push through that pregnancy, is one hell of an experience. So I've had nurses come in late at night and I'm on Netflix and they're like, oh, what are you watching? You know, that's just, I welcome that. I welcome that, because you're being a friend. Because not all the time your family can stay overnight. They can stay as much as they can, but then they got to get back to work. And then there's some days when you're by yourself. So being that nurse that will just step in and just talk about life and just help you take your mind off of what's happening right at that moment is so helpful. And bringing medication on time. I've had nurses forget about my medication. You know, even the other day when I brought my son into Emerge at Sick Kids, we were there literally from 1 a.m. till 1 p.m. the next day. And I saw the doctor at 11:30 a.m. And I had to sit there with him. And I said to myself, imagine if he had sickle cell. I would be furious right now, you know,
Yeah.
but don't hesitate to exercise your rights. Advocate for yourself. Advocate for yourself. I've actually heard nurses even tell patients, advocate yourself. You know, something's not right. There's something called patient relations. Don't hesitate to use it. But again, just listen, and understanding is just so important for us. And thank you again for asking that question.
Fantastic. Next question to you both. Maybe Nisha, I can pose it to you first. Did you experience any form of low PCV while pregnant? And if yes, how were you able to manage it with the pregnancy? I don't know what PCV is, unfortunately, so I'll have to defer to you.
I don't know what PCV is either. Let me just Google that quick.
Okay, so maybe we can skip that question in the interim. Yeah. Okay. In the interim, someone says, thank you so much for sharing your inspirational stories. Were there other options available for pregnancy with sickle cell that were given to you by your doctor, such as, freezing eggs, maybe going the surrogate route? Was any kind of counsel given to you in that respect?
No.
Perfect.
I had that nurse, not sorry, not a nurse, a doctor told me that my eggs were old. She made that suggestion. But her logic at the same time, it didn't make any sense to me, because I was fairly young at that time when she said your eggs are old. And I said, how? Like, it just didn't make any sense to me. I didn't do any research and followed up on it, but I definitely didn't freeze my egg. I was like, I'm not doing this. This doesn't make any sense. So I just left that alone.
Perfect. Okay, jumping back to the question that we just were trying to investigate, Nisha, and around PCV, packed cell volume is what the acronym stands for, or hemoglobin level, basically. So it's like, did you experience any form of low packed cell volume / low hemoglobin levels while pregnant? And if yes, how were you able to manage it with the pregnancy?
Yes, I did. But that's where the exchange transfusions came in. In regards to how I felt at home and stuff, really just resting, like Tia said. But if it came to a point where my energy was low or I needed that extra boost, then I would just have to go to the ER.
I didn't have that issue.
Okay. Okay. I'm not sure if this would be a new question, but someone's asking, what complications do you have with sickle cell? Maybe you could provide a general response.
What complications in regards to what?
Yeah, I'm not entirely sure.
Like
Maybe that.
I get crises like most
Yeah.
people. I needed my gallbladder removed. I had 12 gallstones. I had my hip replaced 2015. So because I had my first daughter in 2014, that was really challenging because my hip was so bad I couldn't even open my legs to put it in the stirrups. My husband had to literally hold one leg while the other was in the stirrup. Um, I don't know what other complications. I had the pulmonary embolism, as I said before. And I don't really like to talk about this one, but I've also been diagnosed with 3 brain aneurysms. So they're just watching those right now. But I really don't really share that one because it gets me emotional. But we're just watching that for now. But I hope that answers the question.
I hope so too.
For me right now, for the last 5-6 years, actually, I've been experiencing AVN, which is a vascular necrosis. They're not ready to operate yet. I actually do want them to operate because my left shoulder is horrible. I only can carry the baby on my right side, especially because of his weight. I don't really do heavy lifting because of it. Like Naisha, my eye has been a challenge for me to share because I literally was driving one day and couldn't see. And so what I did see was actually blood in my eye, like dots of blood in my eye. And I ended up in emerge 3 times before they took it serious. So that was a horrific experience for me because I wasn't able to drive for months after that. So please, if you do need to check your eyes, do it once a year. I did see that pop up in the chat. Your eyes are very important. You need them. So other than that, I've been okay. I do have to get an MRI too for my head. So those are checkups that I just recently learned about. But otherwise, my eye, which is I have an appointment actually next week, and my AVN just waiting to look into that.
Okay. How do you cope with exercising during pregnancy, Anisha, Thea? Was that something you had to think about? And this person saying, haven't been pregnant, but exercising is a struggle, and sometimes I think triggers a crisis for them. So
Yeah,
maybe any insight you can share.
I didn't exercise in pregnancy. I was actually happy for the weight gain. I'm really tiny, guys. I'm like 95 pounds. So I mean, that doesn't mean I'm healthy. I'm just very tiny. But now that I have my kids and they work out and they're in sports and I'm not keeping up, I do work out now. But like you said, it can trigger. I talked to my hematologist, and he always says if you do happen to go to the gym, dress warm, extra hydration. So even before you go to workout, hydrate. During the workout, hydrate. Listen to your body. You know, when they say but listen to your body. You know there's a balance, right? So now I do try to work out, but I have to kind of put breaks in between so that I'm not triggering a crisis. If I decide that I'm not working out for 2 weeks and then I go and do a hard workout, then I'll probably be on bed rest for 2 days and can't move and trigger a crisis. That still happens to me now. So I do smaller increments, break in between. If I do go to the gym with hubby, then I dress warm and just really hydrate. In pregnancy, I didn't work out. I wanted that little fat, but it didn't stay.
Working out has been helpful for me when I do it according to listening to my body. So 1 year prior to me getting pregnant with my daughter was my healthiest time because I was actually working out. I had a routine. I had changed my diet around, and I didn't have a crisis for 1 year prior to giving birth, prior to getting pregnant with her. After that, I went back into the gym, and that was helpful again. But when I got a personal trainer, I put my body through a lot. And that's when I learned that you cannot overdo it, because within 2 days of working with my personal trainer, I went into a severe crisis attack. So I didn't go back, because you're not supposed to overdo it. You're not supposed to have strenuous workouts where you're lifting like 100 pounds and all that stuff. You have to have a moderate amount. Hydration is very, very important. So I do encourage working out, but again, you need to do it for yourself. And if you're going to have a personal trainer, just have a limitation as to what you're doing, because your body has to, you have sickle cell, right? So you have to know your body, know when to stop, and know how much your body can handle. I haven't gone back to the gym yet. I do try to take walks with my boy with a stroller, because I do like to exercise and I find it helpful. But again, I'm just taking my time, because this pregnancy was pretty rough towards the end. So I'm just really, really taking my time with it until I can get everything in order, like my eye and the AVN and stuff like that. But take your time, even if it's just 5 pounds a day, you're lifting 2 pounds a day. Start really small. Start really small and then work your way, and then just have it moderately.
Perfect. One of our attendees sent in a comment about after they did their ABN, they did a total hip replacement, and they gave up in getting pregnant in relationships. They're 42 years old now, and right now have left everything in God's hands. Just wanted to know if you want to send them a note, or reassure them that, like you mentioned earlier today,
What
it's
is,
up
I
to
don't
you.
understand, what does the AVN surgery having to do with it? Like,
Mhm.
you can still have a child. I mean, I understand the pain, because Thea and I have both been there. That AVN pain is quite intense. But Jan Jackson had a baby at 50. Why is 42? I mean, yes, we're older now and there's the risks, but like I said, there's risks in pregnancy, sickle cell or not. But yeah, I don't think that that's a reason to give up. If this is still something that you want and it fits the plan, then why are you giving up? I don't understand that. I would still encourage you, if that's something that you want to do, to do. The AVN surgery should actually put you in a better position, because after the first one, I was like Thea, where I could only carry the baby on one side and walking up the stairs, 1 foot at a time. If you're getting in the car, you got to lift the leg, getting in the car, certain positions. And I'm going to be very transparent. Sexually, you can't do, because you're in so much pain. Getting up and down from sitting to standing. But I don't know. I don't know. Is it the age? What is it that's deterring you? Because it shouldn't. I don't feel that it should stop you if that's still what you want to do.
Well said, Nisha.
Yes, Rael?
My friend, you don't have a name, and that's fine, but we're all friends here. Relationships are hard, regardless if it's a friend, workships, friendships. Don't give up. Okay? Don't give up on yourself. Don't give up on the person that you think is belongs to you. I always say that there's someone out there for everyone. So make sure that you accept what God has for you. Right? Celebrities are having babies at 50 years old. So don't make you stop you. The only thing I see that could be a concern is your age, yes. But again, we have a strong healthcare system. You can, there's all the tests here. At 39, because my birthday was a week before my son, I had to get tested for, I don't know what the test is, but they test the baby for Down syndrome, all that stuff. It's what you believe. So don't give up. Please, whatever you do, don't give up. You deserve to have whatever your heart desires. So just don't give up. If you believe in God, pray about it. Whatever you believe in, talk to them, the universe, whatever the case may be. But don't give up. Because even if you didn't have sickle cell or you didn't experience AVN, you would still have to go through the testing at 42, 45, or age 50, right? So that's what you want to do. Don't give up. It will work out for you.
Thank you both for those responses. There's about one or two more questions. This is actually a really good one. Do either of you have examples to share where you had to advocate for yourself for adequate care or support while pregnant? You both spoke to it, but I think what's really important is, if so, what did this look like in practice? Like, how did you actually activate your own advocacy for yourself? And do you have any suggestions for folks who worry about having to advocate for themselves with healthcare providers?
I can go.
Oh,
I
because would
can't
you go
think
to
of
you
in
first?
pregnancy, just in general with
Okay.
sickle cell.
Yeah.
I guess the main one that we all experience is being drug seekers or whatever. I did after I had the pulmonary embolism. I went back in after having a chest crisis. I knew something wasn't right, went back in. And the team that I was with lowered my medication by 50%. So now I'm in crisis, but I also have this pulmonary embolism, which I can't even breathe. And they put me on a PCA pump and cut my dose in half. So now I'm in more pain and half the medication. And the doctor, the team, or the one, I think there was opioid team or whatever, came in and they're just like, we just don't understand why you need this, or why you want so much medication or whatever the case may be. And I asked her if she's in my shoes, like, can you feel what I'm feeling? And she's like, no. So I said, so how are you going to say that I can't, or I shouldn't feel what I'm feeling, or I don't need the pain meds that I'm requesting because you're not in my shoes, you don't feel what I feel? And she didn't have an answer for that. So I said, can I speak to I don't want to be a Karen, but can I speak to your supervisor? And she brought in the doctor, or whoever her head person was, which was even more rude than her. And she was just like, I'm the one that cut your dose in half. And I'm like, why? And she's like, well, the doctor that prescribed it said his sister has sickle cell and she doesn't take the pain meds. Excuse me? My sister has sickle cell as well, and my sister doesn't come, she ain't in the ER either, but that doesn't mean anything. Each patient you deal with accordingly. I could have sickle cell, my sister has sickle cell, but our crises, our pain, our tolerance, and everything's different. So I said, would it be possible for you to leave my room right now? And she's like, have I upset you? I said, well, yes, you've upset me, but you're not helping me. So can you call my team? And I didn't realize there was an actual hematologist doctor in the next dealing with the patient beside me. And he overheard and he went and told my hematologist, and my hematologist came down and he said, did you want me to tell him what happened? And I'm like, no, it's okay. And that lady ended up coming in and apologizing to me. And I asked her, why? What are you apologizing for? And she said, I looked over your care plan, which she should have done before she cut my dose in half. And she said, I realized that I was cutting your dose in half and you came in for an added issue. And she says, and I also realized that stress is a trigger for you. And I guess I stressed you out. And I said, yeah, that's why I asked you to leave my room. But advocating for yourself can be challenging because if you're in a bed and there's no one, you're buzzing and the nurse or whoever doesn't want to help you, you're kind of stuck. You just got to deal with it. But if you have, contact with your nurses, your doctors, I sent a text message to my doctor. Hello, Dr. A is being this way with me. Can you come and handle this? But I know that with myself, when I'm in pain, and that's not just with people, I shut down and I don't really speak. Like, that's just my way of dealing with pain. Like, I get very quiet. So my mom, my siblings, my husband, they know when I'm in pain because I just kind of pull myself away. But somebody else might not look at it that way. They might be like, oh, she seems very chill. She seems very calm. She seems like she's not in pain. That's the way I deal with my pain. I don't have to always be screaming at my top of my lungs. If I am screaming at the top of my lungs, you should be giving me extra medication at that point. But you have to speak up for yourself, not disrespectfully, but you got to get your voice heard. And that is very challenging when you're in admission and things of that nature. But a long time ago, like my mom and my teachers always told me that ain't nobody walking over me. I don't care how small I am. You're not walking over me. There's certain things that I'm not going to tolerate. And it's disrespect when I'm not feeling well. Don't mess with my children. Don't mess with my husband. Don't mess with my mother. Outside of that, when it comes to my health, I don't want to be here. I don't want to be sick. I don't want to be in this pain. So if you can help me, we can get out of this even faster. I can go home. I don't need to be here. Right. So you got to speak for yourself. But I would say as calmly and as respectfully as you can, because at the end of the day, that person can make or break your situation. Right.
Yeah, you navigate that perfectly though. I love how you
Yeah.
phrased it when you mentioned your responses were to your point. You have to always think about the added layers to being someone in crisis and how they
Yeah.
might perceive you.
Yeah.
Go ahead. Yeah, I know you want to add something as well.
So I have lots of stories. I wouldn't even know where to begin. But my most recent one was one time I took the ambulance to Emerge with my son when I was pregnant with my son. And I actually prepared the EMS team to bring me to the 14th floor. So my advocacy started when I was actually in my home. They called the hospital and said they were on their way with me and that I advised them to take me upstairs. They said, no, bring her to Emerge. I said, okay, you're going to see what's going to happen when I get to Emerge. They brought me to Emerge. They said she shouldn't be here. She needs to be upstairs. They said, so who did we speak to when we called? I said, I told you guys. I told you guys. So long story short, find your voice and use your voice. And if you need to be a Karen, be a Karen because you're not playing with your health out here. Me,
Yeah.
I'm like queen of patient relations. If I hear and feel anything that I do not like, I'm hopping on my phone and I'm starting to type the time, the date, what's happening. I am not playing around. Not playing
That's
around
it.
with patient relations. That right there is my best friend, my go-to.
Good
Yeah.
point. Capturing these moments, if there is any type of malpractice or you've been mistreated, like you mentioned, date,
Yep.
time, names, get all that information down and make sure you
While
advocate
they're
for
talking
yourself.
to me, I'm actually typing everything that's being said so I do not forget and I'm just quiet. But believe me, this is not going to be our last interaction because we're going to revisit this day again.
Well said. There's one final question I see in the Q&A. After having a total hip replacement, were you able to give birth? I presume by natural they mean the vaginal way.
I guess that's me because Thea didn't. Pardon? Pardon me? Yes, I was. I had my hip replacement 2015 and my two other births came after and I had them naturally and vaginally.
Fantastic. Okay, so man, that was a very engaging session. We're about 5 minutes out. Are there any last questions for our two panelists? Speak now, forever hold your peace.
We're right on the money and time.
Yeah, I'm not seeing anything in the form of hands or any more questions coming through in the chat. Okay, so with that, I'm just gonna, oh no, I lied. No, good job. Thank you. You're both heroes. Just folks actually sending their kind messages. Thank you both for your amazing stories. Really great to hear and have a friend with sickle cell, and so teach me how to be more of a help to her. So thank you so much. Yeah, that's great. We definitely need friends in all different places. To that end, I just want to once again thank our speakers, both Nisha Curtis, Thea Campbell. You've provided an invaluable service to not only all of our audience members, but to SCAGO. I know this thanks will never be enough, but just please take it with take with that our utmost gratitude for you taking 2 hours out of your busy Saturday mornings to spend them here with us. I learned a lot. took away a lot for folks. Like we mentioned, this will be recorded. Please do share it with your friends and family members who could also take and learn from this. With that, I'm going to be able to gift you with the the everlasting gift of time with 4 more minutes to take with and do it with what you will. But I thank you all for joining us. And once again, you can find a recording for this session at sicklecellanemia.ca. So have a lovely rest of Saturday, a beautiful rest of your weekend, and go in peace. Thank you so much.
Bye,
Thank
guys.
you. Bye, everyone. Take care.
Bye.
Bye all.